Hello, I'm Judson G. Sprandell II. I am from Ohio. I have been in practice for 39 years. I have done two previous shows regarding veterans seeking chiropractic treatment in the community. Today's issues of discussion are very slightly different. I'm going to discuss the opioid epidemic, which is worsening. I am going to provide research which supports our theme of chiropractic first, which stops opioid abuse. I'm going to provide copies of national treatment recommendations which support the use of chiropractic treatment. I'm going to supply my recommendations and strategy to fight back against the opioid pharmaceutical epidemic. I'm going to highlight the Foundation for Chiropractic Progress information packets, which are awesome. And I'll combine that with my experiences too. So, all right, let's go to the slides. Okay, opioid overdose deaths are increasing across the nation during the months of the COVID pandemic. There's a report by the Office of the National Drug Control Policy dated January 19th. Their strategy has three related elements, which includes prevention, treatment, and recovery. The policy actually states that preventing drug use before it starts is a fundamental tenet of a comprehensive approach to drug control. There have been recent articles that have reported that officials are putting more emphasis on stopping people from using drugs to begin with. There was an article in a Columbus, Ohio newspaper which states it's no-brainer. Fewer people using, fewer people becoming addicted, less demand for product on the streets. So prevention is one of their action steps, but it's been my experience I don't see much action with prevention. There is a lot of information regarding, or a lot of action steps regarding treatment and recovery, but not prevention. And prevention is where our chiropractic profession can shine. So the following information I have is just shows you the data of what's going on with this opioid epidemic and how bad things are, and it's getting worse. The data shows that 80% of the heroin addicts reported that they began using oxycodone and hydrocodone for pain control. In 2017, 70,000 people died from drug overdoses, making it the leading cause of injury-related death in the United States. Of those deaths, about 68% involved a prescription or illicit opioids. And adults between the ages of 25 and to 54 years old had the highest rates of opioid deaths. Now, in 2017, there was 191 million opioid prescriptions written in the United States, which is 6 times more than in 1999. Wrong way. Okay. Now, recently, in February of 2021, opioid overdoses were determined to be 29% higher than they were in 2020. No, it said that the opioid overdose were higher in 2020 than they were in 2019. This study also stated that there were 70,000 lives lost due to drug overdoses in 2019. This study was from the months of March to October of 2020, and it identified that the overall emergency room department visits for opioid overdose were about 29% in 2020. Now, according to the AMA, more than 35 states reported increases in opioid-related mortality. On August 14th in 2020, the AMA submitted an updated report and stated that as the COVID-19 pandemic continues, so does the nation's opioid epidemic. Now, recently, too, this was out of Dynamic Chiropractic. It states that patients with acute pain were significantly more likely to transition to chronic pain when they were exposed initially to non-concordant pharmaceutical diagnostic testing and medical subspecialist treatment recommendations. Now, non-concordant is dividing into 3 categories. Any prescriptions which include opioids were considered non-concordant. Non-concordant diagnostic imaging includes x-rays, CT scans, and MRIs. And non-concordant medical subspecialty referral includes the referrals to non-surgical or surgical specialties, which are the physiatrists, the orthopedists, the neurologists, the neurosurgeons, and the pain specialists. But actually, the study is showing that patients were significantly more likely to transition to chronic pain if they chose their medical profession initially or medical physician initially. And actually, the report states that among the potential factors leading to chronicity, the authors considered non-concordant care or care not consistent with established guidelines, which we'll talk about later, but So they're saying with the not consistent with the established guidelines, the care was changing these people into chronic pain patients, which they do rely upon the prescription way of treatments. Now, I have three slides here with has 13 references to research, which documents or substantiates that chiropractic first stops opioid abuse. These research articles ChiroSecure will send after completion of this program. But these, I mean, the research is just phenomenal. I mean, I've never seen so much positive research for chiropractic treatment. As an example, Optum states that we can save $230 million if patients choose us first. Also states that we can reduce opioid use prescribing by 26% a year. The other study that I'd like to highlight is that it's, which included 200,000 patients. It states that our patients choosing chiropractic first, we can reduce the likelihood of opioids by 90%. So the data here is phenomenal. And again, this is in a separate paper, which I put together. Really, it's a table, which I sent to ChiroSecure, which they will send upon completion of this program. And these articles are referenced to for you. Well, there's 13 references to, so that'll be a part of the paper. Now, there's also positive guidelines out there. There's national guidelines, which again state that non-pharmaceutical pain treatment should be utilized, which includes chiropractic manipulation as well as acupuncture. And it states that chiropractic manipulation is recommended for first-line treatment options for acute pain and recommended for subacute and chronic pain. These guidelines are from the Centers of Disease Control, the American College of Physicians, the Federal Drug Administration, and the Joint Commissions of the Hospitals. So you can see that the opioid epidemic is worsening. We have research data that says that chiropractic is awesome. We have guidelines which state that they should use chiropractic treatment first. But you know, none of this is happening. I don't know if any of you are in the same boat, but we don't see the increased involvement in treating patients and have coverage for that. This is what we got to change. You know, I like this quote from Edwin Burt. It states, "The only thing necessary for the triumph of evil is for good men to do nothing." So I changed it just a tad. I feel it's time for DCs, both good men and women, to focus on issues that affects all of us in our practices. All the DCs need to be on board. Our focus, in my opinion, should be on emphasis on education, focusing on the benefits of what we do. You know, we cannot continue to ignore the ongoing and now worsening nation and statewide opioid overdose drug epidemic. We need consistent plans to educate employers, local unions, military veterans, and our communities. Our job is to shed the light on our third-party payers' refusal to improve and or just add chiropractic, full scope, and acupuncture treatment to their benefit packages. So, recommendations. These recommendations are more of a grassroots effort. If we can get everybody to at least start using some of the F4C information, it's a step in the right direction. The whole issue is about education. So my recommendation is we need to rely upon the Foundation for Chiropractic's progress marketing recommendations, their chiropractic information, and at least we need to send out their social media information, which is usually 4 times a month. There's no excuse for not doing this. I'm sure that most national DCs are not using the foundation's information. In my opinion, all DCs need to be a member of the Foundation for Chiropractic Progress. At least they need to sign up for the foundation as a bronze member, which is a $25 fee. They have silver and gold membership levels, which increases our ability to use what they have. Their information is just top notch. They are about the best organization in the country that will help promote chiropractic. And we should all be members of their foundation. What we've done at our meetings, we have a district meeting, so I represent 5 counties in Ohio. We have a special 15-minute 20 session every month, and we highlight the foundation's programs. This kind of reinforces our commitment to educate the community. We find out that not everybody is using their information, which is just crazy to me. What we need to do is create the same message for all DCs to be on the same page. Our first goal is to create an information packet which can be used at every meeting and or encounter with some minor tweaking depending upon the group or the individuals that we are talking to. Now, I have completed several papers. These are not completed yet. I need to work with the foundation to improve them or make them look presentable. But the papers that I put together is a full explanation of chiropractic care, an employer letter, another letter regarding workman's compensation, general statements, chiropractic recommendations, the research-based data that I talked about earlier, that's in a table. There's also a table with chiropractic cost effectiveness articles. I have included the national and state treatment or guidelines into a table. I've created a paper titled "The Opioid Overdose Deaths Are Increasing Across the Nation." I put together a national Ohio prescription overdose drug data from 1999 through 2017. I put together a veterans information PowerPoint and a veterans research information letter. So these will work on. Once I get them completed, I'll share them. So I haven't completed all this yet, but we're working on it. So we have a major complicating issue. Nationally, Americans do not have the ability to choose non-pharmaceutical chiropractic treatment due to the third-party party coverage limitations. In my opinion, our third-party payer benefit coverage fuels the opioid epidemic by limiting and having no coverage for evidence-based chiropractic treatment. These third-party payers, which includes Medicare and Medicaid, must acknowledge that restricting our treatment results in or fuels the adverse effects of the ongoing drug reliance and drug addiction effects of the opioid epidemic. The third-party payers must recognize the treatment recommendations from the national state groups, which should increase coverage for evidence-based non-pharmaceutical chiropractic treatment. I've had the opportunity to go to community meetings. There was a meeting from a pain management group in my hometown, and we had the opportunity to have input during the meeting. And we basically just stated that chiropractic treatment is an option for instead of drug use. And many of the attendants would say that they would consider chiropractic, but they had no coverage. A local pain management person, they're trying to send patients to us, and they are, but when the patients enter the office, they have no coverage. So this limited third-party payer coverage limits our ability to help fight back against this opioid epidemic. We need to convince them to open up their packages. So part of the education process that I've done in the past and what we're doing in the office is using the tools from the Foundation for Chiropractic Progress Resources. The Foundation has outstanding posters, infograms, brochures, and white papers. It's a good idea to have eye-catching displays in your offices and at community functions. The Foundation has created military veteran rights brochures and created a chiropractic information hospital brochure, which is top-notch. And they're easy reads, and they're beautifully well done. What should be done is the Foundation posters should be hung up in your clinics, and they should be handed out to your patients. This is all part of a grassroots effort that we need to continue with. Now, this kind of gives you an example of what goes on in my office. It's just a display. As you can see, we have posters, we have brochures, we have opioid buttons, we have white papers from F4CP. Actually, we have multicolored pens. These displays works in the office, and these displays should be utilized if you have any tables set up at community functions. Multicolors, this brings attention to attendees. Now, F4CP has outstanding information. Like I said, this is an example of one of they call them infograms. It states combating the opioid epidemic. It's very well done. It's factual information. These can be laid out in your office. You can send them out on your social media. I mean, they're A+ in my opinion. Okay. This is an example of some of the buttons we use. We have one of our DCs kind of made these up. It's a red line through the opioids, and it states chiropractic should be utilized first. We pass these out to all clinics, and we pass them out to the community. And we wear those in the office on a frequent basis. This is another example of an infogram that the foundation puts together. And it states chiropractic is a safer strategy in opioids. Very colorful, very well done. It's very top notch. This again is information you can put out in your clinics or put out on your social media. Again, another infogram is very colorful. It has the facts in there. These get lots of attention if you put them in areas where your patients can see them, or if you go to a community function where you have a table or have a booth. Putting these on a table always generates interest. This is part of what everybody should do. Now, like I said previously, the foundation has put together a veterans' rights information brochure. This is the front and back of it, very well done. It's very simple. You know, it's an easy read. I have many of these throughout the office. We've provided these at our meetings before. It's a top-notch brochure. And this is the guts of the brochure. And it's basically, it's real basic information. This is what does a doctor of chiropractic do, the benefits of chiropractic, and then research. And the research is not extensive, but it's pretty basic. It kind of gives you the idea of what we do. It's good. I mean, when I give these to veterans, they just can't believe that they have access to this. Now, what we did, also we created a local chiropractic district website. It is ohiochiro.org. What we did is we added fight back information against the opioid epidemic. Our website included a one-page opioid fact sheet, how to work with the media, sample articles to educate patients, sample letters to medical providers, sample letters to insurance companies, recent articles of interest. We have a lot of the Foundation for Chiropractic Progress videos, Foundation for Chiropractic Progress PowerPoint presentations, and a few of ours in there. So I recommend pulling up our website, ohiochiro.org, and take a look at our information. This is what has to be done, in my opinion, across the country. Now, we had meetings. What we did was our county had a opioid task force monthly meeting that we found out about and we attended. And some of the things that we experienced with that is that we did better with just a small group of DCs too. When we had more than two, it seemed that we were not well accepted. They were more comfortable just two of us to be there. And what we did is we made that these two DCs, which I was one of them, we went to all the meetings. We went to all the community functions. We created the booths. You know, we were in the booths all the time. And it was very important for us that these outside groups got to know us. You know, when we went to the meetings too, it was imperative to listen to what they're talking about. We didn't walk in there saying how wonderful chiropractic is and all the things that we do. We listened and we just wanted to evaluate what the climate was. You know, we attended these meetings. We introduced ourselves at the meetings. When there were questions proposed to providers and medical professionals, we spoke up. Our message was always very, very simple and to the point: chiropractic first, stop opioid abuse. And I was asked why we were there because they were saying that as chiropractic physicians, you guys don't prescribe. I said, no, we're here to say that there's a non-pharmaceutical way to help you, and that's chiropractic. And chiropractic first can help reduce the opioid abuse in our community. Once we said that, we were accepted. The community group members were very interested in our thoughts and they wanted to know what our action steps we thought should be completed. The group members were definitely interested in what we were doing locally. We provided an update each meeting. We did not get into discussion about chiropractic specific issues. You know, we stuck basically, we stayed the course and that we can stop addiction by treating the community to present with musculoskeletal pain and dysfunction first. Our message was always the same. We repeated over and over again. And we brought all the foundation's information to every community meeting, and then about every meeting, somebody was asking us for more copies. Okay. We always talked to the community about being able to treat musculoskeletal pain and dysfunction. We did not get into other issues. And also this thing that we also did was to, every meeting that we went to or legislative functions, we brought the Foundation for Chiropractic Progress posters and brochures and other materials. Again, their information is top notch, and it's just good material to pass out to somebody. So, my final thoughts for the day, and I'll talk a little bit about the veterans in a minute, but a big issue is that third-party coverage for chiropractic care, in my opinion, is a major stumbling block to increase community access to non-pharmaceutical chiropractic care full scope. Our focus across the country must be educating the employers in our communities to inform them that the current status of the opioid drug overdose epidemic it continues, and that if they can increase chiropractic coverage, we can benefit this ongoing tragedy. So, the only way we can get things done is work as a group and work as a grassroots effort, and we need to use the information that's available to us and do it on a repetitive basis. Now, lastly, before I finish, is that I had 2 previous shows about veterans seeking chiropractic care, and it remains a fact that our veterans do not know that they have the right to seek chiropractic or acupuncture treatment. The veteran must be eligible through the VA as VA members. The DC must be certified through Optum to treat the veteran. The veteran has to actually obtain a consult with the primary care physician or the pain management physician. Then that physician will send a request to the VA. The VA will then send an authorization to the treating DC. This is not an easy process, everybody. It's not. It's a lot of red tape, a lot of headaches. But there's 10 million veterans in the United States. There's almost 800,000 veterans in Ohio. Our veterans need us so bad. Most of the veterans respond well to our treatment plan, which I use acupuncture in addition to chiropractic. We really have to work on educating the veterans that they need to come see us. And remember, in 2018, that the Veterans Health Administration did a chiropractic directive with the number of 1210. This was released on May 25th, 2018, and states that chiropractic care and acupuncture are included now in the medical benefits packages. The standard health benefits plan generally available to all VA enrolled veterans. Now, the directive actually lists some pro-chiropractic comments. It states that patients receiving chiropractic care are less likely to use other healthcare services and are more costly and have greater risk, such as opioid medications, spinal imaging and injections, and elective spinal surgeries. The directive states that patients receiving chiropractic care have a lower overall healthcare cost for episodes of non-operative spine-related disorders. So in a nutshell, everyone, it's just about education, and it's about being a grassroots effort. We all have to roll up our sleeves. It's not too hard to use the foundation's information, which is the key to our educating our employers and our communities. So we must continue to do that. So this concludes my presentation. I want to thank ChiroSecure for asking me to do the show. I do not forget that our host next week will be Mike Bisco. Thank you for your time. You all have a nice weekend. Thank you.